Going live now. They're just trickling in.
Try to keep it low key, easy going. So we'll read out questions, and whoever feels best qualified to answer, just step up.
Yeah, and I see a lot of our members are coming on right now. That's wonderful.
Okay.
Give it another minute. So
that people again, I'm showing participants are coming in now. Are you going to record?
okay. It's already recording.
Oh, wonderful. Okay.
Automatic, yeah. So we have about 62 people that have just trickled in right now. So I think we're going to get the ball rolling and get started on this. Hello, everybody. Welcome to the Ontario PSW Association and the Canadian Support Workers Association second COVID vaccine town hall in partnership with Unity Health Toronto. I just want to say thank you so much for coming out tonight, and I hope that we can answer all of your questions and all of your concerns and your curiosity surrounding the COVID-19 vaccine. We did receive all of your questions that a lot of you sent in to us through our emails at the association. A lot of those questions, unfortunately, will be answered at the end. So we just wanted to let you guys know that we'll be answering those questions for you guys at the end. And as if you guys don't know who I am Miranda Ferrier. I am the president of the Ontario PSW Association and the CEO of the Canadian Support Workers Association. And I'm joined by my colleague Ian De Silva, who is our director of operations for both said associations. And now I'm going to hand it off to Ian to introduce our wonderful panelists that we have with us today. Take it away, Ian.
Thank you very much, Miranda. Thanks to everyone for joining. I am Ian De Silva, as I was announced. Tonight we are joined by Dr. Kevin Gough. Kevin Gough is an infectious disease consultant and the head of the Division of Infectious Diseases at St. Michael's Hospital. Kevin is joining us. We welcome him tonight. Dr. Isiwara Manoharan is a second-year infectious disease fellow from the University of Toronto. She's originally from Mississauga and has stayed in Southern Ontario for her medical training, having completed medical school at McMaster University and internal medicine residency at Western University. She plans to pursue a career in community ID and continuing to serve the needs of her community very much. Welcome very much. Thank you. And last is last but not least, is Dr. Christine Song, Assistant Professor, Department of Internal Medicine, Program Director, Clinical Immunology and Allergy, University of Toronto. Dr. Song is also Staff Physician of Division of Clinical Immunology. Thank you all for joining us this evening. Miranda, we will just go through the questions and we can answer them as we go through. Thank you very much.
Okay, well, thank you very much, Ian. So as a lot of you guys know, at the OPSWA or the CANSWA, we like to take things kind of laid back. We're not very regimented in how we do things. We like conversations to flow and to get the answers to you guys of what you need. So with that, I'm going to just ask my panelists if you feel that you can answer the question or if you can follow up to the question that one of your colleagues has already answered, please feel free to do so. We'll just see how this goes. So the first question, of course, that I would like to ask is, what are the COVID-19 vaccines that have been approved for use in Canada? This is a popular one amongst our PSWs.
So maybe I'll start with that one. So the question we saw was, how do the vaccines work? And in particular, what are these mRNA vaccines? So the vaccines contain something called messenger RNA, or mRNA, which is a particle that teaches our body how to make proteins. That's all it does. It's kind of like a recipe for making proteins. We've got all sorts of mRNA in our bodies already because we have lots of proteins in our body that need to be made. So it's nothing new to our body. It's not a living virus. It cannot cause infection. So the messenger RNA that's in the COVID-19 vaccine teaches our body how to make a protein that's on the outside of the virus particle. It's called a spike protein. And that spike protein is what allows the virus to attach to our cells and to enter the cells and to replicate and cause infection. So imagine what we can do if we can block that spike protein. And that's what the vaccine does. It teaches our body to make antibodies against that spike protein so that when we see the real virus, the spike protein is neutralized by the antibodies, so it prevents the viral particle from entering our cells, replicating and causing infection. So it prevents infection that way. So that's what the mRNA vaccines are all about.
Thank you very much. Anybody else would like to add to that, or that pretty much answers the question right away, doesn't it? Perfect. So the question is basically, how safe are these vaccines? I know that from our membership with both associations and just hearing from PSWs on the ground, they're concerned, one vaccine over another. Am I safe? You know, I have asthma. I have, you know, high blood pressure. I break out in hives if I'm around somebody who's, you know, has taken penicillin, for instance. So, you know, would these vaccines be safe for these PSWs?
So maybe I can speak to people who have certain allergic predispositions, because although those are only just a few of the examples that you gave, but certainly very relevant. So right now, you know, for people who have had an allergic reaction to the first dose, then absolutely. And what I mean by that is if someone has had their first dose of one of the vaccines, whether that be the Pfizer vaccine or Moderna, and broken out into hives, swelling, difficulty breathing, you know, anything that resembles an anaphylactic reaction, then yes, that person should be assessed by an allergist just so that we can sort out the safest way to then get any subsequent dosing. The other situation where people have to be cautious perhaps is if people have a known allergy to something called PEG, or polyethylene glycol, which is one of the components that is in the Pfizer vaccine. It's also in the Moderna vaccine as well. It's not a very common allergy. So if you've ever been diagnosed with that would be something that you would need to talk to an allergist about first to determine how to safely get the vaccine in perhaps a more monitored setting and perhaps with some pre-treatment. Anything else though, so if people have a history of food allergies, if they have a history of medication allergies, if they have a history of spontaneous hives, which is considered sort of an autoimmune condition, those are not contraindications to getting the vaccine. So what I'm telling my patients right now is there might be a slightly higher risk of having a reaction, for example, like if someone has a severe allergy to a food, but we're saying you should still get the vaccine because most people who have allergies are still going to do fine. I just remind them to make sure they bring their EpiPens with them. And they should be carrying their EpiPens with them everywhere they go anyway. So that's no different. And then there was a study that came out not too long ago identifying that it was roughly, 11 in a million people who are having anaphylactic reactions to the Pfizer vaccine. That's quite rare if you compare that to the risk of actually contracting COVID-19. So just to put that into some perspective.
That's wonderful. No, that's a really good point. And I mean, even just for me in my personal life, that was a really good answer. I guess the next one too, though, as well is what they're wondering is what are the common side effects from these different vaccinations? Is there a difference in side effects, like, a short-term, long-term, local, systematic between the two vaccinations? And to follow that up are the side effects different in older people versus younger people?
Maybe I'll let the ID people tackle that first, and I'm happy to add to that.
Absolutely.
Sure. The side effects that are reported with both of the vaccines, Pfizer and Moderna, they're things that you typically get with other vaccines anyway. For example, the influenza vaccine. So pain at the injection site. Some people report fatigue, headache, muscle pains, chills, that sort of thing. They're all reported to be either mild or moderate. Very few of those are severe reactions, and they might last a day or two. So for example, I got my first shot at about 1:30 in the afternoon. And then that evening at about 10:30 at night, I was lying in bed and I rolled over, and I actually felt a little ache in the arm when I rolled over. And it made me smile, actually, because it reminded me that I got the COVID vaccine today, and that was a good news thing for me. And then I got the second dose I just got my second dose this week. And the only thing that happened to me was I was really tired. So I came home and I had a good 10 hours sleep, which I really needed anyway. So that was a good thing. People have different reactions to the vaccine, but the ones that are most commonly reported are the ones that I've described already. So whatever happened when you got your last flu shot, for example, or your hepatitis B vaccine might work for you. And in terms of the ages, so in the studies, the youngest person was 16 years of age that they allowed in the studies. So the data are collected on people who are older than that. Interestingly, Health Canada has a website where they're collecting information on people who've received the vaccine in Canada and have developed side effects. And it's a really good website. You can see what everybody's experience is so far. And I looked on it before we got on today. And so far there have been 90 reports that came in. Most of them were not serious effects at all. And that's after about 602,000 doses have been given out. Now, this depends on people reporting. They have to get on and report themselves. But around the age, it's interesting, people who are older than 65 were least affected by the side effects. And then the most affected tend to be age 18 to 50. But keep in mind, this depends on people going on and actually reporting themselves. But so far, that's what's been reported. And that website is accessible if anybody wants to have a look at that.
Thank you very much for that, Kevin. We will actually share that link on our websites and share it out to the panelists as well.
They're constantly updating it, so it's a good source to go to.
Absolutely. We actually had a question come through, and the question around vaccines reactivating shingles. This is a question that that has been asked by some of our viewers right now. And who would like to take that? Does the vaccine reactivate shingles?
Okay, I can take that one if nobody jumps in. So the short answer is no, and we don't know. So there's a question around, can the vaccine trigger autoimmune diseases where one didn't exist before? And can it trigger things like shingles? And there have been no data so far from the studies that have been done to suggest that this can happen. So the short answer is no. And it's not been reported that I've read in the side effects from the vaccine. And the other thing is, can it trigger other autoimmune diseases? And the answer to that is no as well. And Christine may want to expand upon that a little bit, but that's another question that we commonly get asked as well.
Excellent, excellent. Go ahead, Dr. Song.
Yeah, no, I would agree. The answer right now is it's no, and we don't fully know. But again, it's also really important to recognize, it's actually, when we look at other vaccines and we talk about potential very ever so slight, cases of, maybe something being triggered, like another viral infection or an autoimmune condition, the chance of that happening with the viral infection itself probably is much higher than the chance of that happening with the vaccine. So again, there's all these sort of potential what ifs, but it's also has to be balanced with, well, the alternative to not getting the vaccine and the very high chances of, actually getting the viral infection. And again, the danger in that would be much higher than the chance of these things happening with a vaccine.
Okay, well, thank you. Thank you. Go ahead, Dr. Gough.
Yeah, and shingles will often reactivate when your immune system is suppressed, whereas the virus tends to stimulate your immune system. So it doesn't make sense from a biology perspective either. But anything can happen, but so far it's not been reported.
Okay, thank you very much for that. We're getting lots of questions in right now from our attendees. I'm just giving you guys fair warning because I'm trying to stay on track with the questions, and it's just, you're going everywhere. Sorry?
In the chat about the shingles, so I'll just follow up on that. If somebody
Sure,
has
please.
shingles now, should they get the vaccine? So the answer would be, wait until your acute shingles episode settles, and then you would be eligible for the vaccine. You don't want to go in and get the vaccine while you have shingles for a couple of reasons. It's going to be very uncomfortable, but you're potentially infectious to other people as well. So wait till you get over that acute episode of shingles, and then yes, you can get the vaccine.
Excellent. Thank you very much, Dr. Gough. Much appreciated. So I'm just going to jump to the next question that says, what are the common side effects? Oh, no, that was the next one. How effective is the vaccine? Let's talk about that. Is one dose effective? I think that's what a lot of people are wondering. If just one dose, will I get the COVID if I have just one dose?
So in terms of how effective the vaccines are, so the studies showed that the Pfizer vaccine was about 95% effective in preventing COVID infection, and the Moderna was about 94%. So excellent results for both of those vaccines. But that's after 2 shots. So Pfizer is 1 shot now and a second shot 21 days later, and Moderna is 1 shot now and the second shot is 4 weeks later. So you're protected with the Pfizer vaccine 1 week after your second shot. So that's a month from your first shot. And with Moderna, you're fully protected 2 weeks after your second shot. So that's 6 weeks from your first. So that's in an ideal setting. In response to your question, 1 dose, it's recommended that both doses are received. However, with supply shortages that we've all know about, it's been suggested that the interval be extended. Both Pfizer and Moderna have done some really preliminary work on how effective that first dose is. And after 14 days and before the next dose, both of them say it's about 92-ish% effective. But this must be taken with a huge grain of salt because it's very early data, and that's not what the study was designed to look at. So what does all that mean? It means that we should try to get the vaccine as scheduled. If we can't, because of supply issues, both the World Health Organization and Health Canada have deemed that it is okay to receive the second dose up to 6 weeks or 42 days afterwards. It makes sense because we do that with other vaccines that we give that are multi-dose. So with hepatitis B vaccine, for example, we give a dose now, a dose in a month, and a dose in 6 months. Most of the benefit comes after the first dose, and the second and third doses just boost that initial response and make it last longer. So although we don't know for sure with this particular vaccine because those studies are underway, it seems to make sense by vaccine experts that the same thing would hold true for the COVID vaccines as it does with other multi-dose vaccines. But again, those studies are underway and we will have some answers on that in the near future.
Okay, thank you very much, Dr. Gough. I think that would help out greatly. This is actually directed for Dr. Manoharan. If your internet, I know she's been having some internet issues, but welcome. The question is about hesitancy, vaccine hesitancy in the workplace. Have you witnessed this? What are the issues that you have seen directly?
Sure. So to start off with, I would thank you for having me. But I would definitely say that I have experienced that in the workplace for sure, not only amongst other, people in the community, but also people that I've interacted with in the hospital across a range of healthcare professions. I can say some of my fellow residents, so other doctors who are in training, have come up to me and asked, do you think it's safe to take the vaccine? Should I take it now? Should I wait? I've also had nurses come up to me and ask me these questions as well. And I think a lot of it comes from a place of concern about how quickly in their minds that the vaccine has rolled out compared to, say, in the past when it's taken longer for vaccines to come onto the market and be available for use. But what I try and tell, my fellow residents or other healthcare workers is that technology has come a long way since many vaccines that we know have been developed. And it's actually quite remarkable how much we've advanced in science and in medicine that it's actually made it possible for us to produce these vaccines and bring them to scale so quickly. A part of the reason that these vaccines have taken a shorter period of time to come onto the market are a few reasons. One is that the method, so the mRNA vaccine, actually lends itself to being able to produce it more quickly and to get it to trials more quickly by the way that by its mechanism. So it's not a live vaccine. As Dr. Gough mentioned earlier. Number two, sometimes the reasons that medications can take time to come onto the market and pass through regulations is for bureaucratic reasons, which of course the whole world is on the same page, trying to counter this pandemic, and therefore we didn't have to go through all of those logistical or administrative hurdles that might happen in other situations. But I always assure people that these vaccines have gone through rigorous clinical trials that we would do for any medication or any vaccine. So these vaccines have already been given to thousands of people before they're approved by, the FDA or the Canadian Drug Association to come onto the market. So it's, these vaccines have already been given, as I said, to thousands of people, and we have data to show that they're quite effective.
Thank you. Here's a quick follow-up question. Have you seen a change for a more positive light towards this vaccine, or are we still dealing with a huge amount of hesitancy?
That's a good question. I would say it's a little bit too early, but I think overall, though, as people have seen, other colleagues get the vaccine and not have any side effects and do well, I think that does help reassure them that, oh, okay, you know what, maybe it's safe for me as well. So in that respect, I would say I expect that we will see hopefully less hesitancy as more and more people get vaccinated.
Okay, because that's similar to what we've been seeing at the PSW Association as well, is as more and more of their colleagues have received the COVID shot vaccination, they seem to have lessened a little bit, although there is still some major concerns. One of those, and I'm just going to go back to, I'm getting questions like crazy as we're on this here. I want to go back to, there's two questions I want to ask. First one is, what about missed dosages? Now, we have a lot of personal support workers who work in retirement or long-term care facilities that have received the first dose of, I don't know which vaccine, which one, but they've received a dose, and they were supposed to get the second one, and their home broke out in COVID, and they were told they would have to wait to have the second one, and now they're concerned that they're not going to be, they're going to have to start again from the beginning. So is that true, or is it okay if there's longer than 2 weeks between, or help them?
You want that one, or I'll take it. Yeah, it doesn't matter. I mean, it matters, but the answer is you should get the second dose. And I kind of talked a little bit about that earlier with out to 42 days. And the recommendation is to continue that vaccine. You don't have to start back at the beginning. And hopefully get the same type that you received the first time. We don't yet know whether they're interchangeable, but you should be able to proceed with your second dose. And we do that with other vaccines like hepatitis A, hepatitis B. If you miss the schedule, we don't restart the whole series. We continue because your body remembers getting that first dose and you get that second robust response.
Okay, thank you. Thank you for that. That's actually going to tamp a lot of concerns that we've been having, amongst our membership and PSWs in general. So thank you. I'm going to be jumping all over the place, so I apologize ahead of time here. We just had another question, and this is, I quote, "I battle with high blood pressure and diabetes. I had the first dose, no significant reaction. Will the second dose be the same?"
I think that's quite variable. I can speak from my personal experience. The first dose, when I got it, I just had some soreness in the arm that went away after a day or so. The second dose, however, I did have a much more strong response. So about maybe 12, 13 hours after my vaccine, I woke up in the middle of the night sort of with chills. I could feel that I had a fever. Just felt like I had flu-like symptoms essentially, but I was able to take a couple Tylenols, and then by the morning I was feeling more like myself, although I did feel tired for about a day or so. But I've had colleagues who had the opposite experience where they really didn't have much of a reaction with either dose, or some colleagues who had who had more severe symptoms, or I should say, after the first dose, but after the second, they were okay. So I think it's really quite variable and hard to predict how person to person you'll react. Yeah.
Okay, thank you. This one is a follow-up again. For those who have had the COVID-19? Now, this has never been asked, so I'm going to be curious to know the answer to this one. For those who have had the COVID-19 before and recovered, do they still need to take the vaccine?
Christine, you're
Everyone's nodding. Everyone's going, yes, yes.
There's much beyond other than just yes, absolutely. We are recommending getting the vaccine, even if you had previously actually had the disease. Obviously, you cannot go when you actively have COVID-19, but it is still recommended.
Yeah, I hope not.
We don't know how long after you've had COVID, we don't know if the antibodies are protective, but it looks like they might be for maybe 3 or 4 months or so, nor do we know how long that protection, if it's there, will last after you've actually had COVID infection. So the vaccine is still recommended, as Christine said, for that reason as well, as because we know that the vaccine, based on the studies, will provide the protection. We don't yet know what natural infection does. So yes, definitely get it. You might can wait a little bit.
Everyone's natural infection has been so different. Like some people end up testing positive and were minimally symptomatic or completely asymptomatic, and that might elicit a very different immune response from that natural infection from someone who is much more symptomatic. So regardless, we do recommend getting the vaccine after recovery.
I think we have full agreement on that one.
Okay. I love the unanimous. Yes, all heads were nodding. That's fantastic. Here's another question here for you guys. I have COVID and considered a long hauler. I am allergic to IVP dye and wondering if the vaccine will actually help me at this point, and will there be a chance of having an allergic reaction?
So back to the issue of having allergies to things that are, not necessarily actually in the vaccine. So again, I think if one has an allergy to something else, especially if it was an anaphylactic reaction, then you are going to be getting your dose at a site that has medical personnel monitoring, and they're supposed to be all equipped to manage any acute allergic reactions. So I would say the allergy to the IVP dye is not a contraindication. That's one of these kind of allergies where that person might not necessarily routinely carry an EpiPen, but if your previous reaction to IVP dye was an anaphylactic reaction, if it were me, I would probably ask my family doctor for a prescription for EpiPen and bring that with me to my assessment or to my actual injection. And then in terms of the question about the sort of the long COVID-19, I think that, maybe Dr. Gough or Dr. Manoharan can also touch on this, but I think we just know so little about why that even is occurring right now. So I can't really speak to that. I can't imagine that that's necessarily a contraindication to getting the vaccine. But I don't know if you wanted to weigh in on that a little bit more.
Sure. You're right. We're seeing people who have these long haul symptoms, and that's being sorted out and actually being studied. And I'll get to that in a second. But having said that, there isn't a contraindication to getting the vaccine because of that. So you've had COVID before, you may not have a durable response, especially if you have COVID back in March. We're now in January of the next year, February of the next year. If you did have an antibody response, it may not be there still. So yes, you should get the vaccine, even if you've had COVID before and you have sort of long haul or post-COVID infectious symptoms. Around the study piece, and I'll send the link back to your group here, to Ian, as well. There's a study that's going on that you can actually refer yourself to, where there's a group of professionals, healthcare providers from different disciplines, from looking at psychosocial aspects of long haul infection, at the medical, biological aspects of it, and trying to understand this long haul syndrome better. So I'll send that link to Miranda or Ian, and then if you want it, please give that out, and you can actually self-refer. So that would be really good as well. So you'll contribute to new knowledge, but also get some insights into what's happening with yourself.
No, thank you very much. That's a really great. I just have to remind everyone that we are also answering a supply of questions at the end. So, because I think a lot of people are anxious for us to answer all of their questions all at once, and some of them actually relate to the COVID command table more, and we have answers on that, but we're going to do it at the end. Okay, the next round of questions is, can the vaccine impact fertility and pregnancy? And that is also followed up with, can the vaccine cause erectile dysfunction?
Reverse the order, probably best.
Yeah, reverse the order maybe a little bit. Those are the two
Levity.
questions.
Just for levity.
So I can answer that question around the pregnancy and breastfeeding piece. So the Canadian Society of Obstetrics and Gynecology has actually come out with a statement giving their opinion on what pregnant and breastfeeding women should do. And essentially what they've outlined here is that being pregnant or breastfeeding is not a reason to deny someone the COVID-19 vaccine or say that they are not eligible for it. The Society recommends that it's a decision that's made between the patient and the healthcare provider, and that right now, the opinion of the Society is that the risks of getting COVID-19 in pregnancy, of getting the actual disease, outweigh any hypothetical or theoretical risks of getting the vaccine. And the reason I say that is because we simply don't have any data really or yet about the effects of the COVID-19 vaccine in pregnancy. And the reason for this is in the trials that were done, these trials are typically not just for COVID-19 vaccine, but for most trials for medications are done in patients who are not pregnant. So typically these patients are not included in these studies anyways. And so that's why we don't have that evidence. That being said, for the Pfizer vaccine trial, I believe that although none of the women in the study knew that were pregnant at the time that they got the vaccine, I think there were about 23 patients who, after they had received the vaccine, found out that they were pregnant. And those patients were followed afterwards by the study coordinators. And to date, there have been no adverse events reported in those patients for what it's worth. But as more and more women get vaccinated, we'll over time have more data on that. But for the time being, the recommendation of the, as I said, the Obstetrics and Gynecology Society is that pregnant women and breastfeeding women are eligible to receive the COVID-19 vaccine, and there's no contraindication as a result of their pregnancy.
Thank you.
Great point. And I think one of the things that the Obstetrics and Gynecology Society mentions as well is that we do know what happens to pregnant women when they get COVID. And we know that they're hospitalized more often, they go to the intensive care more often, and they're put on a breathing machine more often than pregnant women who don't have COVID. So balancing that out with a risk for the vaccine that we don't know, the recommendation is to get the vaccine. So pregnancy and COVID don't do well together. Jordan, erectile dysfunction question. So the bottom line to the erectile dysfunction question is we really don't know, and it's not come out as a complication of the vaccine at all. But what has been sort of proposed and not necessarily proven is that having COVID might actually increase your risk of erectile dysfunction because it can cause problems with blood supply through blood clots and inflammation in blood vessels and that sort of thing. Again, it's not been proven, but it's been hypothesized that getting COVID could potentially lead to erectile dysfunction, according to some urologists, but the vaccine is not implicated at all. So there's a short answer.
I'm sure some people are breathing better after that answer. You're in PSW world now, doctors. This is a difference.
Well, it's the same in every world, I think.
Yeah, exactly. Yeah, exactly. So we had another question that just came up, and I know we've kind of touched on this, but I think it's really important that I ask this for one of our attendees that are watching us right now. And it says, I have Graves' disease. And I heard that if you had an autoimmune disease, you should not get the vaccine. Is this true? We've been hearing a lot about this. I'm sure you guys have as well. Can we just answer? Can we answer it definitively? Is that even possible?
I'm waiting to see if Christine. Okay, there she is.
Well, it's one of these things where, at least at our site, a lot of the different divisions have been talking about, because even the term autoimmune disease is a little bit of a broad term, right? And Graves' disease is an example of sort of an organ-specific autoimmune disease. Then you have other autoimmune diseases that are much more systemic. And my understanding at this point in time is still kind of similar to the discussions around pregnancy and getting the vaccine is, we're weighing the risks of getting the actual COVID-19 disease, the infection, and how that could potentially impact the autoimmune disease versus the vaccine itself. And so I know even on intake, when people show up for the vaccine, there's often this question of, do you have an autoimmune disease? But for right now, at least most of the divisions are saying the risk of the vaccine, of getting the vaccine, is likely lower than the potential risks of actually getting the infection. So right now, the recommendation is still to get the vaccine. I don't know if my ID colleagues want to add to that, just in terms of like the data, looking at patients with autoimmune diseases and specific. I don't know the data specifically on Graves.
So that absolutely, I agree with what you've said. And there was a question in the chat I saw about multiple sclerosis as well. So autoimmune diseases in general and immunosuppression are very different. So autoimmune diseases and immunosuppression can vary in the type of immunosuppression, but also the severity or degree of immunosuppression. So there isn't a one answer fits all here. So this is one of the recommendations where we say you should really speak with your healthcare provider, because your individual case may be different. So some people that are on a lot of immunosuppressants for some reason, the recommendation might be to defer getting the vaccine until those medications can be weaned off. Not because you'll get COVID from it, but you'll respond better to the vaccine when your immune system is stronger. So I guess the short answer to that question is that would be one that you speak to your healthcare provider about, given your particular situation, how severe or not your immune disease is, and what medications you're on, and whether they can be tapered or not. So I would talk to your healthcare provider about your individual case. But as a rule, I agree with Christine, you can get the vaccine.
Yeah,
So,
and the other kind of flip side to that, which is probably less common, but people who have immune deficiencies, right? Who have, whether it's because of their medications, but also people might just have these innate immune deficiencies. And some people we know don't necessarily even generate good antibody responses. But for now, the nice thing about the vaccines that are currently approved and available, as Dr. Gough had mentioned, they're not live viruses. And so when someone is immunocompromised, for whatever reason, we do, for the vast majority of these patients, and again, I agree with Dr. Gough, it's to have that discussion with their healthcare provider, but it's not that it's not safe. And even if we don't think that their immune response would be as robust as we would like for it to be, it still provides probably better protection than nothing. So many of our even sort of profoundly immune deficient patients, we are recommending that they still do get the vaccine. That would not have been the case if this was a live, partially replicating viral vaccine. That's not what this is.
Okay. That's a great answer. Thank you so much. I think we're getting so much out of this. This is unreal. I'm loving this. Okay, so I'm actually going to skip back over to the questions that we had beforehand for a second here, because I think my favorite, there's two really serious questions I think that we would love to have answers on. The first one is the vaccine safe and appropriate for people from different religions? Now, this has been a huge concern as to what is in the vaccination for many different reasons. Was it developed using fetal tissue? Was it developed using animal products? Those are important questions.
Okay. Do you want me to take that one? So I can start. So the fetal tissue thing comes from when the mRNA method was being developed early on. There were some fetal cells, donor fetal cells, that were used to perfect the methodology. That was way back when that technology was being developed years ago. The vaccine itself has absolutely nothing to do with fetal cells, and there are no fetal cells in it. The same as animal products. There are absolutely no animal products in them. I know there's a plant-based vaccine that's being developed in Quebec. It's not yet on the market, but no animal products whatsoever in these two vaccines that we have out here. And in terms of the religion, it's a really good point. And there's a resource that we were provided at the hospital that provided that for me, because I learned that myself when we were having a town hall at our hospital about the vaccine. So there are many sort of North American faith-based communities. So religious leaders have recommended and permitted within the religion the vaccine. And these include the Canadian Muslim COVID-19 Task Force, the Orthodox Union and Rabbinical Council of America, the United States Conference of Catholic Bishops, and the Hindu American Foundation. Those are 4 that I know of that I was told about, but I'm sure there are others as well. So I would encourage people to follow up with their religious communities, their religious leaders, and have that very discussion. Or if there's a website that their faith-based organization maintains, to check that out and see if they comment on the COVID vaccine. I don't know if my colleagues have any other comments to make as well, but that was a really good question, and it was really good learning for me at our own town hall, because I didn't know those resources were out there.
Excellent. So anyone else? Okay, so I guess we can move on to the next question then. And I think this is a big one here, is what happens after the vaccination? So will COVID-19 testing still be required? Can I still be a carrier of the virus and spread it to others? And will I still have to wear a mask and socially distance after the vaccine? Take it away.
I'm sure, actually, Dr. Manahan, do you want to listen? Because I think we're all going to be in agreement on this one.
Sure. So in general, I think everyone would agree. I think we would all agree that even though you may have been vaccinated, it's still very important to continue practicing physical distancing, social distancing, I should say, recommending that we continue to wear masks, appropriate hand washing techniques, all of those things. And the reason for that is, while the vaccine helps with reducing your chance of developing severe disease or symptomatic disease, it does not necessarily, we don't have enough data to show what the vaccine does in reducing our risk of transmitting the virus to other people. There is some data from some of the vaccine makers, such as Moderna, that the vaccine not only helps prevent disease of the individual, but also does help reduce transmission rates. But exactly to what degree, that's not entirely clear as of yet, and time will sort of give us more information as to that. The other thing is the risk of transmission between people who are already vaccinated. The importance of that will go down as more and more people get vaccinated on a population level. But until that's the case, and we're certainly not near that right now, it is still important to practice all of these measures that we've been doing for the past several months, again, because we're not at the point where we've achieved herd immunity, and therefore reducing transmission to other people is very important still. So even if you've been vaccinated, it doesn't mean that you can stop wearing masks. It doesn't mean that you should go visit higher risk relatives, things like that. Just keep practicing all of the things that you've been doing for the last several months, and hopefully as more and more people get vaccinated and we do develop that herd immunity, we can eventually peel back some of these measures such as physical distancing and masking, but I think that's still several months away at this point.
Yeah, I definitely echo that. I would say after receiving the vaccines, absolutely nothing has changed in terms of vigilance about only sticking with my household, other than going to work and then wearing full PPE at work. So I would definitely echo that. The other thing too, so in terms of, when can all of that change? When can we start to open things up? I think rather than our own individual vaccine status, it's really going to be looking to what are the guidelines recommending based on the numbers that are in hospital, the numbers of new cases in the community, et cetera. And ultimately, when we feel like there's a better sense of there being herd immunity, or at least being in a better position where, we're better able to contact trace and actually have a handle on this pandemic. Because right now so many cases are still not traceable, right? So it's still just pretty rampant in the community. The other thing I wanted to also kind of just add to is, and Dr. Manahan brought up a good point, is the vaccine reduces the risks of all these things, like reduces the chance of getting symptomatic COVID and severe disease, et cetera. So again, it doesn't completely fully eliminate that risk. And then the other thing to keep in mind as well is sometimes when people have this has come up before. But you know, when someone gets the vaccine, and Dr. Gough kind of alluded to this as well, it takes some time to actually develop that immunity, right? So it's not like you get your vaccine and then, you know, the next day you have that sort of like 90% or the 95% protection. And one thing that has come up is sometimes people start to get quite sort of flu-like symptoms afterwards. And then the question sometimes comes up, is that a side effect of the vaccine, or could I actually have gotten COVID, right? And so it's important to recognize too, like if somebody gets their vaccine, and if it's more than just sort of like very mild chills or a bit of mild fatigue, if someone's actually getting loss of sense of smell and like some of these other, you know, symptoms, or like a fever that persists, or, you know, other symptoms like that, then, you know, considering that we're talking to a group that's already by, you know, by invitation, a high risk group and likely very much exposed to COVID-19, like you should get a COVID test during that time, right? So there's that period of time, especially right around where you're getting vaccinated, you're still exposed and your immunity hasn't fully kicked in yet. So that's something to also keep in mind, that it takes some time to develop that own personal immunity as well.
Perfect. Actually, I have a follow-up that just came in, and they said regarding if I could speak, right? I think it's Tuesday. It says regarding herd immunity, it has been said it can take upwards of 18 months. Is this true? And reasonably, when can we expect to live kind of normal lives?
No pressure.
Yeah, no pressure at all.
On this because we don't have a crystal ball.
I think the variants have also kind of completely changed the forecast too. Dr. Gough, do you want to address this?
Well, the first question then around the herd immunity. So you want maybe 70% or just over 70% of the population to be immune. And of course, even things like vaccine supply issues that we've run into lately have changed the rate at which that will happen. So there's really no answer to that until we have a good vaccine supply and the means to get, you know, all Canadians vaccinated over a period of time. So I don't know when that will be, but we want sort of at least 70% of the population to be immune. And we need to know what the vaccine supply is going to look like and how that will be distributed, et cetera. So what I would hope would happen was that as that happens, as we develop that herd immunity and more people are protected, fewer and fewer are susceptible, that we will, as has been mentioned, be able to back off on some of those protective measures. But then, as was just mentioned, these variants of concern, these variants, mutations in the virus have come to light. And they've proven to be more infectious, more easily transmitted than the sort of standard COVID-19 that we came to know and love last year. So the challenge with that is that now we finally figured out how this thing is growing and how to protect ourselves. Now we've got these ones that spread a lot quicker. We don't know yet whether they cause more severe disease, but they can infect more people and get more people into hospitals, and then potentially more people would die as a result of that, which is not good. So we have to keep those variants under really good control, which is why we saw some of the travel restrictions that have been put into place in the last week. So it really is a moving target, I guess is where I'm going with this, because we don't know what the vaccine supply will look like in the sort of intermediate term, the short term, and the intermediate term and the long term. And we have variants that are coming in that are messing up the modeling. So I think stay tuned, continue with your hand hygiene, your masks, your physical distancing. And as we see this roll out more and more in the next weeks to months, we'll have a better idea of where things are going. And I'm sorry that's not a concrete answer, but we really don't know.
And yeah, you know what, to be perfectly honest, we get asked the same question almost on the daily at the association. So, you know, I wish that we all knew. I think we had a better handle on things before the UK variant made its way into our province and has ravaged quite a few of our long-term care homes. We just found out of one in Gough today where the hospital is taking over. So
there's a South African, there's a Brazilian, there's a Californian, and there will be many more variants for sure. Just stay tuned.
Yeah. Sounds like a really bad movie.
We ask one more question if I can.
Yeah, please, Ian, go ahead.
Okay, so the question actually just came in now, and it's, as frontline workers, we are prioritized to get the vaccine before the general public. Do you know if our family members, due to close exposure to us, who may carry the virus, even if they've been vaccinated against it, will also be prioritized? So we don't know that question. I think that ties into both things. But there's part of the question there. If someone's been vaccinated and going into the home, is there any risk of exposure through that way? I guess.
With family members, I guess.
Yeah.
Is what you're saying, yeah. You've been vaccinated, but your loved one gets the COVID-19, but you've been vaccinated.
I guess there's a fear that you're going into a place with the COVID that you'll transmit at home. I could be misreading the question. If I am, I apologize. So, but I don't think there would be a risk of that. Okay. So what we'll do is, if you can, we're just going to add in, a lot of questions are coming up now, Miranda. If you don't mind me just jumping in for a sec. A lot of questions are coming in now with regards to the mechanics of delivering of the COVID vaccine to people. How do we get it? What is the supply situation? We're going to address those really briefly now. Just to remind, this was our town hall's focus this evening is on the hesitancy side of the vaccine. So we're not terribly prepared to answer the distribution side or to answer anything like that. However, we did ask the Dirk Heyer, the head of the command table for the COVID relief, and he handles all the province. And Dr. Heyer was basically indicating a lot of these variables are going to depend on the ability of this country to get adequate supply. And at that moment, it's kind of outside. It's simply outside of the hands of our government and our government, our people right now. So because of that, and the fact that the amounts have actually been reduced, it's slowing down the rate in which we can get to everyone. The reality is, it's just going to take longer. The other part, as additional supply is provided, the ministry says that will be offered to staff and other frontline providers who attend the facilities. So facilities are going to be remaining prioritized, and home care worker will be coming down after. The indication is that because of the limited supply of vaccine, places like St. Mike's Hospital are going to be getting the priority, such as the panelists here this evening. Those in home care, we're going to just we'll have to just keep waiting.
Yeah, unfortunately.
The other side of this ties into home care businesses. Again, it's right back into the community thing. The government is still working on, as far as our communication and our stakeholders are showing, that they're still working on distribution models for home care. They haven't firmed on anything at this point. Simply, again, we're dealing with core supply issues, so it's difficult to plan for distributing supplies that you simply don't have. However, there is priority listings, which is simply the best that we can do considering we don't have the supplies.
Ian, can I just say one thing?
Please.
I know that a lot of you guys are really familiar with how the flu shot rolls out. And unfortunately, even when the flu shot runs out, shall I say, there's significant backup for that really quickly. And unfortunately, in the case of the COVID, like we said, not everyone has been vaccinated. The vaccinations are not coming in fast enough. The supply is not coming in anywhere close to fast enough. Like Ian said, if anything, it's slowed down almost to a halt at this point. And so the core of the COVID still remains in long-term care facilities and hospitals at this time, and retirement homes. They're not forgotten. Retirement homes as well. And so therefore, but I will answer one question that did come across our desk a few days ago on our group on Facebook, which I did see, is I'm a private home care provider. I have my own company. I go into the retirement home every day to supply care to, X, Y, and Z in the home. The retirement home is getting vaccinations. Should I not be included in this? Yes, you should. So you need to approach the owner, the DOC, whoever in this retirement home, and you should be demanding that you as well receive the vaccination. It would make absolutely no sense for everyone else in the home to get the vaccination, but not you. So that is to answer that question as well. Thank you for answering those, Ian.
And just to clarify, the question that we had earlier, the attendee was just specifying that it was more a concern about home care, the people that you live with, are they going to get vaccines? So for example, Dr. Sung and Dr. Gough and Dr. Manoharan, are your families eligible, for example, for if you're members of your household?
No.
Their answer. It's just the people that work there. So when the government means frontline and they need priority, this goes back to the beginning, I think, Miranda, when they were talking about the fortress around these facilities, and I think that ties into that general strategy from the beginning. So
absolutely. And no, it's not great news for Canadians in the community. I would agree. I just saw something pop up. Unfortunately, there had to be a phase 1 and then a phase 2. I wish that we had an abundance of supply coming into Canada. As you guys are well aware, we sit on provincial and federal tables regarding this, and they're working 24/7 to try to get these vaccinations in the door. Unfortunately, Europe took priority. That's what it looks like right now. So we have to wait our turn.
But
we
it
just
is
gotta keep-
there is a Canadian-made vaccine that we
Yes.
heard about today, so there is good news coming down the line.
There is good news. There is good news. So I just wanted to ask each of our wonderful panelists here that joined us tonight. Do you have any last parting thoughts for our personal support workers and friends that decided to join us tonight? Any wisdom you'd like to enlighten upon us, or last thoughts?
I did see a couple of things kind of pop up on the chat, but just a really quick thing. There was a question about asthma. If someone has asthma, should they still get the shot? And if so, does it have to be at any specific site? I would say for people who have asthma, again, a very common condition, by all means, please, if you have no contraindications to the vaccine, we are recommending getting the shot. I wouldn't say that there's any specific site you have to get it at. The most important thing is that your asthma is very well controlled at the time. If you feel like your asthma at the time is not well controlled, please talk to your doctor. Make sure it's under control before you go in to get that shot. But the only other thing that I just wanted to say to everyone is just thank you for all of your hard work, because again, I know everyone kind of throws this term like frontline workers, but really when I think of frontline workers, I really think of PSWs as like truly frontline. So I just want to say thank you.
I'd like to echo that. Thanks so much for all the hard work going on in the long-term care facilities and all the places where PSWs provide support. And so it's a pleasure to actually be able to give something back through this session. So thank you very much. I would just like to say that, when this vaccine first came out, I was kind of hesitant as well and wondering, why did this happen so quickly? All the questions that you've asked tonight. And so, like I'm sure the rest of my colleagues here, we all did a lot of research. We want to learn about this, and we did. And I think I feel confident in saying that I've looked at all the data, I've looked at the studies, I've looked at the safety, and I've received my vaccine. And I would encourage you to do the same. And if you're still not sure, if you still have questions, then ask the questions and get the answers to those questions so that you feel comfortable and confident in getting the vaccine. And both my contact information I left with Miranda and with Ian. So if there are any questions that I can help with after the session, which I'm sure my panelists will agree to help as well, please send them our way and we'll get back to you. Because the idea is to provide you with the information that you need to make a really good informed decision to get your vaccine. So thank you. And any questions, feel free.
Thank you very much.
Thank you.
Thank you.
Dr. Manoharan, do you have any last words, wisdom?
Hard to follow up on that, but I would say that I agree with the sentiments of both Dr. Song and Dr. Gough. And thanks again for having us all here. And thank you so much for all your hard work.
So with that, I just want to say thank you to all of our personal support workers and friends and employers, et cetera, that came out tonight again to view. This was a smaller town hall this time around, but to be frank, it was fun. I had a good time. Good conversation, good flow, not as much pressure breathing down our necks to have a good town hall. So that really worked out. And like we said, PSWs, like our doctors said, if you guys have questions, you guys have concerns, you guys need answers, these guys are the experts, and the association is more than happy to facilitate sending questions and getting answers from our wonderful panelists. And maybe we'll do another one. Who knows if this continues on longer. So I just want to say a big thank you to all of our panelists. A thank you to my colleague Ian for putting together this town hall, and a really big shout out to Dr. Sharon Strauss, who you guys did not see on the call, but she is the one that worked so hard to get us all together yet again from Unity Health Toronto. Much appreciated. It was a great evening.
Sharon, let's see your little face here. Come off your camera.
Oh, come on, Sharon. There she is. There she is.
Sharon
So
has
wonderful.
spearheaded this and has been an enormous.
It's been a huge help.
Enormous.
Our fearless leader.
Absolutely.
Very much so, yes.
Absolutely.
My pleasure
so
and
much.
privilege.
And we'll follow up with you after. We have lots of work.
All right, so thanks so much, everyone. Have a enjoyable Tuesday evening. Stay safe and remember, wear a mask, stay home, and if not at home, stay at work. Thanks so much, everyone. Take care.
Everybody. Thank you.
All right. Bye, everyone.
Nice meeting
Take
you all.
care. Bye.